What up, YouTube Digital? Looks like the Obamacare pricing plan has come out today, and what a joke. Anywho, businesses are trying. This is a joke. This is putting all the money on the patient. This isn't affordable. This is a joke. My healthcare is cheaper. And not because I work for the company. Shit, ours is more than most people's. Which is kind of funny, but anyhow. Most people do not know exactly how healthcare actually works. I have not, in 13 fucking years, read an article or a fucking TV whatever that was right. I even had a local reporter who wanted to be Ted Koppel or some fucking shit. Fuck up so bad. And when I said, look, dude, you're completely 100% wrong. Nothing you said is real. And he wanted to fight me over it. And I go to Wikipedia, go look up healthcare TPA. That's how almost everybody is insured in America. That's how the government does it. That's how business does it. It's just how it's done. He didn't know anything about HIPAA except for it's a privacy law, but he didn't know the other parts of HIPAA. The other parts, like for pre-existing, that everybody talks about that hardly any plan really has anymore. Pre-existing, there was already a law out since 1996 that stated if you had credible coverage for the last 18 months, with no gaps larger than 61, 2 or 3 days, I forget which one, the new company has to waive all pre-existing conditions. Also, pre-existing conditions could not be applied to a newborn. And there was a couple other little diddly-doos. The problem, I'll start off with pre-existing. The problem with pre-existing conditions, what people don't realize, is people don't want insurance, which is fine. Nobody gives a fuck. But what happens? Plane full of people. What happens is they'll find out that they have stage whatever cancer, and then they will jump on the insurance bandwagon. And then they would want people to pay for their $100,000, $500,000, $600,000 treatment, and then they would jump off at the end. And I know people have this big misconception in their head that, oh, don't worry, it's the corporation's money. No, it is not. Don't ever get that in your head. It's your fucking money. I mean, let me put it this way. It's my fucking money to the point that anybody that works for my company, and if I find out they went to the ER with a cold, I'd smack the shit out of them for wasting my money. That's how much it is my money. I'm not even fucking joking. If you work for a group, and usually group insurance is determined by employee size, usually that's about 2,500 or more. And so, or it could be a union, the local whatever, and they could have group coverage through the union. All of those people that are part of that group are pulling all their money into one pot, and then the claims are paid. Now they determine cost by risk, and that's generally how it works. It's a little more complicated, but I'll get into that later. But pre-existing was put in place so people couldn't just jump on and off the bus and basically steal money. And not Vader's crying outside the door. I ate a couple pieces of pizza this morning for breakfast, and I don't eat the crust. Why? It's a waste. But he loves them. And he wants them. Hi, Vader. You'll probably go wake up my wife to have her come open up the door. But anywho, pre-existing. So it's basically stealing of others' money. That's what it comes down to. Now, even if you're a new person, like say you just got hired on with my company and you got cancer, now I wouldn't mind. You know, what the fuck? You know, you can't control that shit most of the time. I wouldn't care. But say you work with my company for 6 years, but you didn't want insurance, and now you want insurance because you got cancer. Well, fuck you. Where were you when Joe Blow had cancer? Why weren't you helping him? People don't realize that actually this is really social insurance. It actually is. They just don't realize it because they're told lies all the time. Now, let's go to what two major types of insurance there are. And if you want to know if you have health care and you want to know what type you're on, and it doesn't say it in your plan booklet, you can call your customer service and you can ask them, are you a fully insured? Or are you a self-funded, URSA, whatever the fuck? Now, Ron Paul was on TV the other week trying to fucking talk about bullshit that he didn't know what the fuck he was talking about. He contradicted himself 5 times in that interview that I paid attention to. His interview was fail. But people thought he was so great because they like to suck his dick. That guy's such an idiot. Most doctors do not understand how it actually works. That's why they pay people to be the billers and shit. Because they don't understand. They understand how to treat people. They don't understand this shit. So I end up being the one that gets in all this shit. My job is to, when they don't understand, is to help them understand, because a lot of times I'll deal directly with them instead of their biller when they get pissed off. So I have to help them understand all this shit. Okay, now back to the two major types. Fully insured, self-funded. Okay. Self-funded. Self-funded is a major group. I'll just use Google. I don't know if my company insures Google or not. Don't give a shit. I'll just use them as an example. They would be a self-funded group. They are large enough to be their own insurance company. Now, the tax breaks that Ron Paul was trying to insinuate don't really exist, because the group, when they do group insurance, they come to an insurance company. They say, we want to do a group policy. We say, okay, cool. Then we say, okay, now let's take a look at your employees, your age brackets, the demographics, blah, 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 to help get the risk factor going. And then we help them, we show them basic plans and shit, and then they can do whatever they want. If they want to cover 15 boob jobs a year, they can do it. It doesn't fucking matter. If they don't want to cover gastric bypass, they don't have to. It's all up to them. Remember I said that. Comes in later. Now, the supposed tax breaks don't really exist because that group is taking on the admin cost of half of the deal, instead of outsourcing the insurance via fully insured, which would be every individual has a contract with that insurance company, like your auto insurance. They're going to take on the task of billing all of the employees out of their paycheck. They're going to group the money into a bank account. They are going to design a plan. They are going to lease our doctors. They're going to lease our claim payment system. They're going to lease our call center. They're going to lease our name, our letterhead, the right for their employees to cuss us out. And we will administer their plan that they come up with, and we will call them every month and say, okay, we got X number of dollars in claims waiting to be paid. And they will wire the money into a mutual account, and we will pay out of it. Now, this is how the bulk of insurance works, including Medicare, TRICARE, Medicaid, Medi-Cal, and what other 2 or 3 other states that has Meta something, because the states are allowed to change the name from Medicaid to whatever. Like California's is Medi-Cal. And I think Florida changed theirs to Florida Care or something like that. But it's Medicaid. Even those plans do the same thing. Okay? So the tax break bullshit is not really there. And here's another thing. If you quit your job or get fired, you get an option of COBRA for 18 months. Or whatever it is now. I forget. Don't give a shit because I don't deal with that anymore. You'll notice if you look at the COBRA paperwork, your insurance triples. Well, it's tripled because the employer is not going to pay for your shit anymore. They're not going to pay for the cost that they were paying to handle you and help you. Most of the time, the employer is paying 50%. And people don't realize that. It's not really a tax break for them. It doesn't save them money, it allows them to get better insurance for a better price for everybody. It doesn't give them special tax breaks. That there are tax breaks in effect, but trust me, the other costs overdo those tax breaks. Now, here are other things. Um, Now, on my part, my side, now as the administrator, and this is again under like healthcare, TPA, and Wiki, as the administrator, we just get paid a fee. And most of the time, it's a percentage. And if I remember right, we're about for normal business, we're about a 1.5% per dollar. But for government, we're like 15 cents per dollar. Because government healthcare is so fucked up. It's so full of shit. Do we want all this bullshit? Do we get paid more if the claims are denied? No. We do not. We do have performance guarantees in some cases, but those are based on how fast we can answer a call, how accurate we can pay claims, and trust me, we get third-party audits all the time. There are companies out there that specialize just in auditing insurance companies' claim payments. That's it. That's all they do. There are companies out there that audit our phones. That's all they do. The government doesn't audit shit. Matter of fact, the government can even figure out fraud so bad that most of the time the fraud they find is because we tipped them off. Like the 4.3 billion they got in February back. 4.3 billion, and that's what they got back. Now, our advantage in this industry is to try to find different ways to do things better, cheaper, faster, better, all that shit. Now, that's where like HMO came into play. Okay, HMO failed. HMO failed because people kept taking it to the next level, to the next level, to the next level, to the next level, and then finally you're paying more in admin costs than you are if you would just pay the fucking claims. So it became bullshit. Most HMO plans are not HMO. They're not the true HMO that was invented in the 70s. They're made dirty in the 90s. It's not that. It may be a form of it, like an EPO or a POS, which are exclusive, whatever the fuck, I don't even remember. There's so much shit I gotta remember that I can't even remember that shit. I know PPO is Preferred Provider Organization. Was POS, shit, what the fuck was that one? Fuck, I forgot. Forgot what EPO was it too. It's too much. Too much shit to know. See, I gotta know, people don't realize that it's not only like 50 states that regulate healthcare. And then on top of that, you got the normal federal laws. And then on top of that, you have every department of fucking federal government making mandates and laws on healthcare. And I'm not even shitting on that part. Department of Insurance, Department of Labor, Department of fucking FDA, fucking, oh goddamn. Our lawyers are so good that OJ's lawyers couldn't even fetch him coffee. Because that's how bad our shit That's how fucking overregulated we are. But we deal with it. Now, we deal with it at a reasonable cost. We make money because we do what we do, and we do it well. And that's why we've been asked to help other people, like England. The fucking place that has to put a law on itself to make sure it does MRIs within 18 months. Or 16 months. That's fucking brilliant. Now, I'll end this one right here because I want to start the next one with that whole social health care bullshit. Peace.